Tonight you will sleep, maybe as usual. But let me ask you a disturbing question. What if that innocent position you lie in every night is unknowingly putting your health at risk? It may sound exaggerated, but some sleeping positions, especially if you are in a risk group, can affect the blood flow to the brain throughout the night. Let's be clear. It's not correct to say that a sleeping position alone causes a stroke. However, some habits can increase existing risks, especially in whom those with high blood pressure, diabetes patients, those with cholesterol issues, and those with sleep apnea. Now, let's move on to the positions that can be considered the most risky. First, sleeping on your stomach. In the prone position, your neck remains turned to the side for hours. This can put pressure on the neck vessels. At the same time, the chest cannot fully expand comfortably and oxygen intake may decrease. Low oxygen levels throughout the night are an undesirable situation, especially for people with vascular problems. The second issue is sleeping with a very high pillow. Having the head too elevated disrupts the natural alignment of the neck. This can put pressure on both the muscles and the blood vessels. If you wake up with a headache in the morning, the cause might not just be stress. Another important point is sleeping on your back and sleep apnea. In the supine position, the tongue can slide backward and narrow the airway. If you snore or stop breathing at night, the oxygen level in your blood decreases. In the long term, this can raise blood pressure and increase the risk of stroke. So, what is the safer option? Generally, sleeping on your side, especially with the spine and neck in a straight alignment, is considered more balanced. Even a very simple pillow adjustment can make a difference. But the main issue is this. The biggest factors determining stroke risk are high blood pressure, smoking, inactivity, unhealthy diet, and chronic diseases. Sleep position alone is not to blame, but it can be a small link in the chain. When you lie down in bed tonight, think about this. Am I truly comfortable, or am I just sleeping this way out of habit? Sometimes a small change can make a big difference in the long run. If you enjoy this kind of health and awareness content, don't forget to subscribe to the channel, like the video, and write in the comments, which position do you sleep in the most? Maybe the change starts tonight.